Peyronie, disease or not disease? Disease or not disease? That's the question we ask ourselves today, friends of AskFabio. The so-called Peyronie's disease, first described around 1700 by François Gigot de la Peyronie, has never really been reworked in the guidelines, remaining almost unchanged for centuries. But are we sure it's always a disease? Today, let's try to clarify. What is Peyronie's disease? Good question. When we talk about Peyronie, we are generally referring to a curvature of the penis that can be more or less pronounced, possibly with narrowing or the formation of scar tissue. Traditionally, we call it Peyronie's disease, but in reality, the definition is still not completely clear or universally shared. That's why we want to bring some order to the topic. The most important question is, when can we really call it a disease? It's important to emphasize that Peyronie truly becomes a disease when it causes problems in the sexual sphere or significant psychological distress. For example, if the curvature prevents penetration for purely geometric reasons, or it causes pain, or if the patient, feeling deformed, cannot calmly live out his intimate life. Why don't we accept penile deformity? One of the main reasons is that we never compare our penis with that of others. Instead, we are used to observing people's faces, hands, and ears, and we realize that these also age or change shape over time. The penis, on the other hand, remains an intimate aspect invisible to everyday comparison. When we notice changes, reduced length, altered width, or a different curve, we tend to label it abnormal and fail to accept it. But it's an organ like any other. Just like the nose or ears, the penis can also change over the years. And if it doesn't create any functional or psychological discomfort, there's no reason to consider a slight curve or a small scar a disease. Sometimes small scars can develop in the penis that cause a barely noticeable deviation, like having a slightly crooked nose. It doesn't necessarily require treatment. Think of a deviated nasal septum. It only becomes a real problem if it prevents proper breathing or causes severe aesthetic discomfort. Similarly, in Peyronie, we don't consider it a pathology as long as one's physical and psychological quality of life remains good. When we encounter a more pronounced curvature, pain or difficulty in sexual intercourse, or significant mental distress, we typically schedule a specialist visit. The doctor can physically assess the situation, sometimes recommending an ultrasound of the penis to identify and measure any plaques. You can also take photographs at different times, during erection and at rest, to determine the actual angle of curvature. The available treatments vary depending on severity, from pharmacological therapies, injections into the plaque or oral medications, to specific penile physiotherapy, up to surgical intervention in the most complex cases. However, it's crucial to understand if the curvature truly compromises sexual function or psychological well-being. If there's no significant impact, no intervention may be necessary.